Okay, so while they are setting back the presentation, thank you for being here. Thanks for also organizing this, our dear business partner in Greece. Really, I'm happy to be here just to share some of the innovation United Imaging was able to set. And talking about innovation, 5 Tesla is definitely one of those. And somehow everyone has been looking for ultra high field since, I would say, 15 to 20 years. It started with the animal studies. But indeed, why are we trying to figure out to improve and to increase the magnetic field? One of the reasons is definitely SNR. I mean, everyone is telling you as soon as you are going to higher field strength, you are increasing the signal to noise ratio. You are able to reach higher resolution. Typically, this is what Stefan was presenting with the city, and this is exactly what is happening with the high field strength for the magnet. Another effect that is improving with the 5 Tesla, with increasing the magnetic field, is the susceptibility effects. And so typically every time you are going to a higher field strength, this is what you see between 1.5 and 3 Tesla. Definitely you see this as well for 5 Tesla. You are increasing this effect and you are able to better depict every kind of microbleeds within the brain. And another effect that is sometimes spoiling your experience while moving from 1.5 Tesla to 3 Tesla is the T1 lengthening. Typically, why I'm mentioning it is spoiling your experience. It's because the T1 images are getting more, I would say, grayish, because the T1 values are pretty close one to the others. And the good effect of this is also you are increasing the effect for every angiography images, and you are improving how far you can reach using this. But everything is not perfect. I mean, going to higher field strength increase several effects. One of those is typically the B1 inhomogeneity within the images. This is a typical effect you can see between 1.5 Tesla and 3 Tesla in abdomen, in fetal imaging, where you are seeing some kind of shadings within the images. And this is typically striking 5 Tesla and 7 Tesla, where the wavelength of the B1 is shorter. So you need to find tricks to improve this. Another effect, same story, between 1.5 Tesla and 3 Tesla, SAR is increasing, local SAR is increasing. And you need to pay attention to this. And if you are going even further at 5 Tesla or even 7 Tesla, it becomes a nightmare. More specifically at 7 Tesla, as you can see in these images, where you can see clearly the heat deposition within the arms and also on the body, on the side of the body. So how can we do such a system, a 5 Tesla system, that is able somehow to be installed in a 3 Tesla room? Maybe not because of the weight, let's be honest, the magnet is still heavier than a 3 Tesla system, but definitely regarding the fringe fields that are exactly comparable to a 3 Tesla system. What does that mean concretely? That means just one thing. Every single injector, or every single electrical device you put within the 3 Tesla system can be located exactly at the same location for a 5 Tesla system. And because United Imaging is really experienced in terms of magnet design, we are able to provide you with a really good homogeneity, B0 homogeneity of the magnet, even for large field of view, like this coronal view where you have a 40 centimeter with a fat saturation and no or barely defect of the fat. However, there is another challenge, which is the B1 homogeneity that I talked a little earlier. And this challenge can be overcome by using several RF channels. So at 1.5 Tesla, you only need one. At 3 Tesla, definitely it's better to have 2. And here at 5 Tesla, we are using 8 body RF channels. And because this body coil is emitting the radio frequency waves, we don't need anymore to use transmit and receive coils for those systems. So we are able to provide you with all kind of coils that are only, I would say, receiving coils. So the whole work is done by this 8-channel body coil. And this is how we were able to create this 5 Tesla system, which is one part of our portfolio, starting from 1.5 Tesla to 5 Tesla, with CE and FDA approved system. The 5 Tesla is approved for CE and FDA. The 9.4 Tesla, let's be honest, you don't want to use it, especially for your patients. It is a 30 centimeter bore size. It is dedicated to rodents and to animals. But definitely one thing is sure, all those different systems are sharing the same platform, which is called Wi-Fi technology. This is really exactly the same features, the same software algorithm that you will find on our 1.5 Tesla, 3 Tesla, and 5 Tesla. And it is exactly the same story regarding the advanced applications. Everything is within this configuration, and you are able to do whatever you want in terms of acquisition. You don't need to wonder, do I have my cardiac package, for instance? It is within the platform. And so this leads you to being able, with the ultra-high field, to acquire brain images or knee images. At least it was what was possible with 7 Tesla. But now with the 5 Tesla, because we are using a body RF coil and receiving coils, we are able to provide you with images not only in the brain, not only in the knee, but for every single body part. And it is, as I stated earlier, a CE-labeled system. You might wonder, is it a research system? I mean, if you heard about the workflow on the 7 Tesla, definitely I would answer no, it's a research system. But because the 5 Tesla system has been designed with the clinical workflow, it is definitely a clinical system. Not only because it is CE marked, but it is used as presented here within about 40 facilities in China. It will be installed by the end of Q1 this year in Madrid, in Spain. So you will be able to have also feedback from a European radiologist. It will be also installed in the Netherlands. And definitely what people are saying about this system is we don't see the difference between a 3 Tesla and a 5 Tesla. I mean, in terms of images, definitely you will see the difference. I mean, I will show you afterwards. But in terms of workflow, in terms of patient throughput, it is exactly the same thing as any clinical system. In terms of protocols, of course, you are looking for higher resolution. So you are spending a little more time than what you are used to. But definitely when you look at those different protocols that are today clinically used within hospitals, it definitely looks like whatever you are doing at 1.5 Tesla and 3 Tesla. But as I stated, in terms of images, you reach a different level. You reach really high resolution images like those 2 acquisitions that are 0.4 millimeter isotropic acquired within 5 minutes. Same story regarding what you can do with those techniques. Here you have a higher resolution regarding all kind of acquisition like susceptibility weighted images. And even when you are zooming a little bit within the T2 images, you are able to identify new microbleeds within the brain. You might have spotted that I am not really a clinical guy. I'm more on a scientific part. And typically, whenever people were talking about multisclerosis, they were always stating this venous sign within the lesions. And here, definitely, because you are reaching the resolution you are expecting from a 5 Tesla, you are able to depict it properly and pretty easily. As I told you, I'm more a scientific guy than a clinical guy. And one of the things I've been working on is typically on 7 Tesla and trying to do some C-spine imaging. And one of my issue when I joined United Imaging was to discover that kind of images where you have a huge high resolution. I tried to do it at 7 Tesla, but it was a nightmare, and we were not close enough to obtain that kind of images. And indeed, in this routine, in this clinical routine, some of our collaborators were able to depict and to better identify, typically here, the different vessels within the subdural hemangioblastoma. I told you this system is not dedicated to neuro. I told you it's not only dedicated to knee. I showed you clearly C-spine imaging, but also I can show you cardiac imaging at 5 Tesla. I mean, if you are doing cardiac application, moving from 1.5 Tesla to 3 Tesla is definitely a challenge in terms of SAW, a challenge in terms of artifacts. Here, when you look at the images, definitely you are able to reach a higher resolution within all the anatomical images, but also on the late gadolinium enhancement. But what I'd like you to look at is the cine. And there might be something very strange. You don't see any bending artifacts in it. Usually you have those black lines within the images, which are artifacts coming from the true FISP acquisition. Here, because we have lots of SAW at 5 Tesla, we are not able to do true FISP images. So we are forced to use the old gradient echo acquisition, I would say. And somehow this is helping us because we are getting rid of the bending artifacts. And the contrast between the blood pool and the myocardium is definitely good enough to evaluate the ejection fraction of the images. Cardiac is a challenging imaging. Definitely at 5 Tesla, kidneys or abdomen or liver or pancreas becomes also pretty challenging because of the breathing of the patient. But because we are able to get higher SNR, we are able to go to higher resolution within the same time. And so this is exactly what you can see here on the left part of the slide. And typically on the right part, I'd like to let you know that these are diffusion images. It's not anatomical. It's not fast spin echo acquisition or whatever. It's EPI and a diffusion. I told you, liver is possible as well. Liver is even greater because you are able to reach those really high resolution images. And this changed a lot in terms of evaluation. What I like to show as well is pancreas images. In this example, maybe you will be looking at something different than I, but typically one of the two images I'm looking for is always the two on the left part, the T2 fat set and the diffusion B50. Why do I look at this one? It's typically because everyone is saying, okay, diffusion B0 or B50 is always representing somehow a T2 contrast. And here, definitely you can see it. Of course, you might tell me, it's a little more blur. Okay, normal, it's an EPI. But definitely in terms of contrast, definitely in terms of depiction of the pancreas and all the areas around the pancreas, you are reaching exactly what you are expecting. Another body part that is always striking me is prostate. I mean, I've been supporting sites for decades, and every time I saw this diagram of the prostate and trying to figure out how it was corresponding to what I was seeing, suddenly using prostate imaging at 5 Tesla, because you are reaching really higher resolution, you are definitely able to depict everything. And here, typically, our collaborators were able to identify foci of prostatic adenocarcinoma. An example I love to see, but hopefully it's not mine, is this example of a bladder. I mean, one of the most challenging locations to image because of artifacts, because of flow artifacts, because of the location as well. And here, because we are able to go to really high resolution with little time, little acquisition time, you are able to depict nicely this polypopid bladder carcinoma. But of course, I mean, high resolution is, Stefan mentioned this as well regarding the bones and how you could nicely depict the trabecular zone of the bones. definitely it's perfect for all kind of MSK, and as you can see here, you can nicely depict every kind of cartilage. You can use any kind of mappings also as well in order to better characterize the joint. But if you remember the title, even though I didn't pronounce it, I told you about from the head to the toe. And typically, continuing in this MSK approach, you can see nicely what can bring 5 Tesla to the table in terms of diagnostic. I mean, you can do every single body parts. You are not blocked to head, to brain and to knee. You can do everything you want. And this can be run by one single technologist. You don't need any scientists right next to it to work on the B1 homogeneity. And I hope, and this will be my last slide, and I hope that by what I presented to you and to what you were able to see in terms of images, that I convince you that 5 Tesla is definitely a clinical scanner. I mean, it's not a research tool. It's not something just for any guy. It's really something that is ready for diagnostic and for patient. In terms of SAW issue, in terms of peripheral nerve stimulation, of course, I'm employed by the company, but the first thing I'm always doing for any kind of system I want to present is always to experience what the patient is experiencing. And my first test was asking for a C-spine exam on me because usually I get heat. Usually I get PNS, especially on 70 centimeter ball. And here everything went well. Heating a little bit, let's be honest, but PNS, none of them. Clinical workflow, as I told you, it's definitely built like that. And one of the things I could witness, because I visited sites in China running the system in clinical setup, is that the system was run by one single technologist, taking care of the patient from the beginning to the end, doing all the injection and not waiting for anyone to let him know, okay, you can continue or not. It's compatible with all anatomies. You showed it. I showed it. Even cardiac, even though you might be surprised of this. And definitely you have higher spatial and temporal resolution using that kind of system. And this definitely opens lots of avenues in terms of studies and research capabilities. Thanks for your attention.